people don't realize with hypogammaglobulinemia that it's not just an autoimmune disease against your globulin, right? Some protein, right? There's probably not any good explanation or answers to that coming up to the program. Am I correct with that? Hi, everybody. Today we are interviewing Shari, and she has suffered from hypogammaglobulinemia, as well as POTS symptoms, asthma, GERD, adrenal fatigue, and severe joint pain. In fact, her joints were hurting so much and swelling so much, she couldn't even wear her rings or had trouble getting out of bed in the morning. Well, I'd love for you guys to see where she is today. I'm Maggie Yu, MD, and I am a functional and holistic medicine physician and the creator of the Transform Protocol and the Facebook group Transform Autoimmune Disease Naturally to turn around any autoimmune issues around naturally. And if you are watching this on YouTube, go ahead and give us a thumbs up and a subscribe. If you're watching this on Facebook, give us a like. And if you know anyone that would benefit from watching this interview, put their name in the comment section right now. If you haven't joined our Facebook group, make sure you join our Facebook group, Transform Autoimmune Disease Naturally. Today, I would love Shari to introduce herself to our audience. So Shari, go ahead and introduce yourself.
Hello, I'm Shari Rhodes. I'm in sunny Florida, but it's not too sunny here today.
So Shari, what kind of work did you do and what did life look like before you joined the program?
I used to work in nuclear power plants, and it was a very stressful job.
No idea.
8.5 years, I did contracts, major projects, and then I did root cause analysis. So if something happened in the plant, you had to do a root cause. But anyway, it was a lot of hours, very stressful. And 2012, I quit my job. I was sick all the time. So I quit the job. It was time.
So Shari, what are some of the diagnoses and symptoms you had prior to joining the program?
Last year, I was diagnosed with hypogammaglobulinemia, adrenal insufficiency, and a host of other things.
Including POTS too.
I was diagnosed with POTS back in 2009. And I believe that came on because at 43, I started going through hormone issues, postmenopausal, and then by 49, I was through it and POTS hit me like a ton of bricks.
I love what you're saying here because it sounds like as a root cause analysis expert in a nuclear plant, you started to really figure out what was some of the root causes for some of these symptoms that you've had. You've had POTS, asthma, mitral valve prolapse, and then you got the autoimmune disorder with the hypogammaglobulinemia.
There you go. You said it better than I did.
Peter Pepper with the piper.
Exactly.
Not to make fun of an autoimmune diagnosis, but to me, that's just actually just one of the targets of autoimmune attack. You actually had multiple. It's just because you have a name to one of the diagnoses don't mean that your adrenal insufficiency, the POTS, even the asthma and cardiovascular issues, they are related to autoimmune, and they in themselves could be autoimmune diagnosis at a later point when we have testing available for it. So I liked what you just said. You thought that hormone changes around your early 40s was a major trigger. Why do you think that, and how did you find that out?
It was really difficult for me to get any history because none of my family, by the time they were in their 30s, had hysterectomies. All of them, cousins, aunts, my mom, everybody.
Now you know why.
And I was like, this is crazy. So I started reading it, and then crazy thing, Suzanne Summers came out with all of that. And so I gathered books. I had gone to 3 different doctors, and they wanted to put me either on a sleeping pill so you could sleep or an antidepressant. I went to 3 of them. I have to have my mind when I work. I can't be on any of that stuff.
Well, the thing is, I went through the same thing when I went into early menopause at 36, Shari. And I'm a doctor that was prescribing these things for people. But then when I came out with these symptoms, that was all that was for me, like sleeping pills, pain pills, antidepressants, and birth control pills.
Exactly.
All of which made me fatter, sicker, and meaner and less functional at work. I lost my job because of all these symptoms and the effects of these medication. So true story here. So currently, let's talk about top 3 symptoms that you had prior to joining the program.
Hives, skin issues.
When you say hives and skin issues, how many years or decades did you have the hives?
20 years.
20 years. How severe were they?
I would say 5 years. I was getting them once a month, I would break out.
And when you had them, they were severe, and how long did they last?
Sometimes they were, a couple days. This last bout in August, I had them for 6 weeks.
Okay, so where are your hives at now? By the way, Shari just graduated from our 2-month program, so this is really fresh. I mean, this has only been 2 months since she started the program. So where are you at with the hives?
I haven't had one outbreak. Not one.
Okay, hives gone that you've had for 20 years. Okay, secret sauce. How did that happen? Like, what was the root cause that you found out in the program? This is my favorite part. I love it when people connect the dots and they see the patterns that I see, which is what I teach in the program. So what pattern are you seeing that's responsible for getting rid of these hives?
I believe it is the gut, the stomach,
Mhm.
what I was eating and not eating. And, that's key to decrease the allergen load that I think I was having. All this time, I have been treated for 40 years, sinus infection, sinus infections. You take Allegra D, you take Sudafed for years.
There's a pattern here. You got sinus
Mhm.
infections, you got
Mhm.
GERD, which is heartburn, you got the chronic
Mhm.
hives. What does that all spell? Digestion issues and food sensitivities.
Input, output, infection. Yes.
Right? And
Yes.
so how did you discover what were the food sensitivities and what did you end up being sensitive to? This is very different. We have a process called food mapping, everybody, completely different than just food sensitivity testing. I know because I created this process. In the food mapping process, what did you find was actually based on your blood data was the foods that was triggering all this?
I really didn't have, if you remember, a whole lot of cottage cheese was my main issue.
And everybody assumes it's going to be 1,000 things. Okay, so what were the foods that you had to remove during the program that created these results? Cottage cheese.
I went gluten-free.
Both, everybody. This is key. Removal of gluten for her. And then number 2 was cottage cheese. We're not talking 1,000 things or another elimination diet here. Based on your own data, 2 things. And how quickly were you able to see the results?
Within 3 to 5 days.
So you were in the middle of
Because
some hives.
yes, I itch constantly at night. Even though if I didn't break out with hives, I would itch. I would itch. I had that itchy skin all the time.
Would you have ever thought in a million years it was gluten and cottage cheese?
No, no,
I love that.
it's crazy,
I love it. Not really when you have the data, right? When you have
right?
accurate data and you're trained in modules with me on what are false positives and negatives for people with autoimmune disease, it was clear as day what the 2 things you had to remove from your food intake was, right? And then the
Correct.
other thing is, to me, I think what's underappreciated that we sort of hit a nail on a little bit was digestion. People don't realize that 90% of people with autoimmune disease and more have digestion problems, especially low stomach acid. And people with low stomach acid don't break down their allergens in the food, raising the allergen load, causing what? Chronic GERD, chronic sinus infections, asthma, and hives. So one of the things we think about is, yes, the gluten and the cottage cheese, but you also worked on your digestion.
Yes, and I love those digestion pills. They're awesome.
I mean, digested. So let's talk about that. When you started taking digested and you learned about proper digestion with the proper hydration, chewing of the food, balancing your
Correct.
food, and taking a supplement to help with digestion. Tell me, what was your reaction when you started working on your digestion?
I take digestive because I had hives and GERD and asthma and pain, and all of that has disappeared. All of it. I take ProMove because I had joint pain in my feet, my knees, my hips, my elbows, my fingers. What it's done for me now, I used to get up out of bed in the morning and I would have to shuffle across the floor. I could barely walk. I don't have any of that. I could not put my rings on because I was so swollen with inflammation. I don't have the inflammation anymore like that.
How long did ProMove take to work for you?
About 5 to 7 days, I think. And from then on, I take 4 a day, 2 in the morning, 2 at night.
It's just gone,
It's gone.
like overnight.
Yes, overnight. It really was.
Nobody talks about digestion. I don't know a single functional medicine doctor or body out there that talks about the role of digestion in autoimmune disease. And so everybody's like on all these elimination diets, eliminating all this and that. First of all, not even based on data. And then secondly, they don't work on their digestion. And I will guarantee you, woman, that 50% of your improvement was because of digestion.
I agree. And no more heartburn pills for me.
Hell no. Hail to the no. Hey, if you want to learn more about the Transform Autoimmune program, make sure you join our Facebook group, Transform Autoimmune Disease Naturally. There's also a link above or below this video where you can chat our team. You can chat us with any of your questions about our program, Transform Autoimmune. Okay, so that was symptom number one, hives. We covered hives. We covered heartburn, sinus infection, and asthma, basically. What about some of the other symptoms besides the hives?
Joint pain, very bad joint pain.
What level?
A 10. I mean, I couldn't, when I get up out of bed, I could barely walk. My feet, my knees, my hands, elbows.
A lot of people don't realize with hypogammaglobulinemia that it's not just an autoimmune disease against your globulin, right? Some protein, right? It's really many other targets of autoimmune attack, including joints. Because people would be like, why the hell would you have feet, knee, or hip pain associated with that autoimmune disease? There's probably not any good explanation or answers to that coming up to the program. Am I correct with that?
Correct.
What level was your pain? You said 10 out of 10. What would you say
Yes.
your level of pain right now is just 2 months later?
I'm taking ProMove and that secret proprietary blend that you have in there, because I was taking turmeric, I was taking quercetin. I don't know what's in there, but I'm a 0. I don't have it anymore. So it's awesome.
It's called Dr. Maggie's secret sauce.
Yes.
So supplementation, but I don't think that's really the only answer here.
No, not if you put all the 5 pillars.
Well, let's think about that. The 5 pillars.
Yeah.
Out of those 5 pillars, what do you think really was impactful in causing this pain to go from 10 to 0 in a matter of 2 months?
It's the blood sugar. I got a grip on that. On my digestive, my thyroid, I got a grip on that. I'm doing supplementation and vitamins.
Okay.
It's all of it.
And I agree with you. Here's the thing is a lot of people don't realize there's a link between blood sugar and pain. Can you tell me how you made that connection? I teach it, but how did you personally make that connection in your own life?
Food was never important to me. And I remember at work, it was caffeine and sugar because you're just going all the time. And, it causes sleep issues, mood issues, the pain. And so once I discovered, you make this so simple with all the pieces, but when you're trying to find out what's going on with you and your body, you read this, you read that, you've got to put it all together. That's the ticket there. So once I found out, okay, Shari, when you get up an hour after you're awake, you eat. 3 or 4 hours later, you eat. And then, because I had heartburn so bad, I was going to eat by 2 or 3 o'clock in the afternoon and I never ate. Well, then you talked about having something to eat before you go to sleep at night.
You noticed your pain kept going up as the day went on.
Yes.
And the moment you start actually eating balanced macronutrient meals throughout the day, it literally ends that whole pain thing in the afternoon and evening cycle. Yes. Low blood sugar was triggering pain. And that's the number 2 trigger of pain for people that they can change within 24 hours.
Yes.
And I found the same thing. My pain was always worse in the afternoon and in the evening. I used to, as a busy doctor, never eat. Like never ate. My one big meal was dinner time. That's it. I didn't even have breakfast, whatever. I was rushing through 30 patients a day. And my pain was always worse in the afternoon and evening, right? So, and then the number 2 thing is digestion is a huge cause of pain. And once you started working on your digestion, you started noticing, guess what? The inflammatory, the histamines and the inflammation factors that you were consuming are now getting digested. So they're no longer causing the pain. Huge. So let me get this right. Pain literally went from 10 to 0 over a 2-month time frame.
Yes, ma'am.
What can you do now effortlessly that 2 months ago you would have thought was impossible?
I'm crafting again. I like to craft and I'm painting. 2 years ago, they were giving me injections. I have a bone spur. I have arthritis. They wanted to do surgery. My arm I don't have that. I know it's inflammation. I know my body has a lot of inflammation. I can see it with puffy eyes beforehand. I
Yeah.
just now have my rings on my fingers because I was just full of inflammation.
How long has it been since you were able to wear them?
A couple years.
This is the kind of thing people don't realize is real, and it can happen in just a couple weeks. This can change. So it's not just like your pain is less. Visibly and physically, you're able to fit a ring that never could get past these knuckles and fingers. Congratulations.
And I know it's a lifelong process. I'm going to do this
Thank
for the
God
rest
it's a
of my
lifelong process.
Yes, yes.
And I tell people that this is too much to launch you into a year of autoimmune turnaround. Yeah, these results are incredible, but literally they're just the first 10% of results that's coming for the rest of the year and continues
awesome.
in your lifetime. Why would you say you almost didn't join the program?
Internet, Facebook, it has a bad rap, in the last few years. But I was so frustrated with doctors. And as you had said at one time, you go in, you have 15 minutes. You have literally 15 minutes to spend with the doctor.
Mhm.
And, okay, if you have a cold and you need something, that's fine. But when you're sick, and luckily though, I had an internist who said, Shari, you've been in here a lot with sinus. I thought I was having sinus infections since I was, 5 years old. And he said, I want, you to go to a immunologist and check out some things here. So at least that pointed me in the right direction.
Mm-hmm.
And I'm not going to let it define me. Okay, so I have some B cells that are kind of wonky, right? I can overcome that. My T cells, I tell them fight if I get sick or if anything goes down, right?
You're absolutely right. I mean, you have a B cell disorder out of your white blood cells. And the thing is, that doesn't mean they don't work. They do work, but they also work with other parts of the immune system. That's one of the major misunderstandings in autoimmunity. People are like, you don't want to rev the immune system up, or you don't want to rev them down, or this or that. It's about the balance of the different branches of your immune system that we are working on. What we do in the 5 pillars is to balance the different branches of immune system to make your immune system work for you instead of against you. That is root cause analysis.
And as women, our hormones, thyroids, adrenals, everything works in harmony, right? And when one goes off, it creates a cascading effect. And I really feel with this program that I'm getting a handle on everything. Yeah, it's not going to go away because it's genetic, but I can manage it and I can feel good.
You can stop the feeding of it, period.
Yes.
That's the difference. Shari, what happened with your adrenal fatigue?
That's another crazy thing. Here I was taking prednisone for a year, right? 10 milligrams, not a whole lot, but prednisone.
It's a lot.
I gained 20 pounds while I was on it.
Yeah.
I do want to say I've lost 13 pounds since September. Okay.
In the last 2 months, you've lost 13 pounds.
Yes.
You were holding back on me. You didn't tell me that.
I couldn't believe how much I weighed. I was so embarrassed. But yeah, 13 pounds. And do I feel like I did when I went in? No, I have my energy because my blood sugar, my hormones, my thyroids, everything is working pretty good. I've got my energy. I can't say enough what you've done for somebody like me, because last year, I am telling you, I was in bed by 10:15 in the morning and I was so depressed. And had my daughter not got pregnant and that grandbaby was coming, I mean, I was going down the tubes. I really felt like I was going down the tubes. So there's hope, and there are good physicians like you. You just have to keep searching and looking. And what I like about you, Dr. Maggie, is you're a functional doctor who goes after the root cause, and because you walked it, you talked it, that all the different illnesses come from different parts and you can correct them.
Thank you. That brought an interesting question to me, which is that, one of the things that you had mentioned, one of the reasons you almost didn't join, you said, was because the internet and online and all this. Now that you actually have been through the program, what do you feel about the internet and the online and all of this?
I followed you for several months, what you had out there. I looked for functional doctors where I lived. There was one who was a sports and it was a male. And I'm not bashing males. I love my husband. I love guys. But as a female, and what I was hearing, I'm like, she knows what she's talking about.
Mm.
So I'm glad you were a resource out there. You can go, Google, you can go to the different sites. I don't use Google a whole lot, but you can go to different sites and research. But there is not a whole lot out there that has your knowledge and your ability to do what you do.
Well, let me ask you something. You've now at the end of the program, our online program, which is 2 months of working with us and our team and getting these results. Do you think that in any way, even if you hired 10 functional specialists over the next 10 years, that you could replicate the amount of education, mentorship, and results that you had just over the last 2 months? And I'm truly asking that from a curiosity standpoint.
To be your own advocate, you have to get the education. You were a doctor willing to put forth what you've learned, and you gave facts, and knowledge is the beginning of wisdom. And if you want to be an advocate for yourself, you have to keep looking and searching.
And so do you think you could have replicated what you've done the last 2 months in any way by going and hiring 10 specialists over 10 years? Is it possible?
No way. Everybody's siloed. They have their own specialty that they want to work in. And no, nobody does root causes. Nobody looks at all of it like you do.
And the interesting thing is, Shari, is that's what was my own experience. When you say I've walked the walk, that was my own experience. Was this doesn't exist. I could not find it for me and my autoimmune diseases at all, right? I had to actually create an educational community-based program online for people in order to make it happen, because I could not get this kind of education, results, or mentorship anywhere else. So that's my feeling about it. And that's why I'm always interested to see, is this your experience as well? Do you share that? Awesome. So I want to thank you for sharing this experience and your journey with all of us here.
And thank you.
Thank you so much for joining us for the interview with Shari. I love the fact that in her story, she's been struggling for over 20 years with symptoms related with chronic fatigue, POTS, joint pain, you name it, and an autoimmune disorder of her immune system. But there is a way with a root cause analysis like she did to actually be able to work on all these targets at once. I'm happy to report, and I'm thrilled to report that her pain went from 10 to 0. This is not an unusual result that we see in our program. Did you hear that? This is not an unusual result we see in our program. And that's just the pain, not to mention her improvement in her fatigue, and also her heartburn and her asthma symptoms and her hives were gone within days. So make sure, if you didn't catch all that, you can go back and watch this interview. If there's anybody that you think could benefit from this message in here, go ahead and put their name in the comment section below, because they may not listen to you, but they may listen to me, or they may listen to Shari and her results. If you want to learn more about our program, Transform Autoimmune Disease Naturally, make sure you join our Facebook group by that name. And there's also a link above and below this video to chat our team. You can chat our team at any time and can get your questions answered. Thanks, everybody.